member who's receiving services, as well as a range of providers and community members and advocates. So we really thank you for your time and the investment that you're making in this work. Please know that we're using this input, we are documenting this and communicating. We meet at least 3 or 4 times a week on this project and are using this input in each of those. So I want to thank you again for your time and wanted to make sure that those who missed our first meeting had a chance to see this summary. And as a reminder, this meeting is subject to open meeting law, so we really appreciate all members of the public that are here as well. The goal is to make this forum as discussion-based as possible, so I invite any that are able to join us on camera and really welcome you to raise your hand. Notably, the discussion section will be with our working group representatives. There will be a chance for public comment after each agenda section, so we will have that as a dedicated slide. So we welcome members of the public to contribute at that time. So with that, we're going to move into our agenda today. I'm really excited to share a little bit of data we have here at Medicaid, both at a national level, a state level, and within our Medicaid data sources as well. Some of this may be familiar to those that have been here a lot longer than I have, but I found this to be a really helpful summary of really where we are at as a state and where we need to go with this transformation. So I'd like to start with some national data here. There is a nonprofit called Mental Health America that publishes an annual ranking of states based on outcomes and access to care. And you'll see here that Nevada is ranked 51st out of 50 states in the District of Columbia. And that has been the case for 7 years, the past 7 years in a row. So as we know, we have significant improvements to be made. You'll see a couple aspects of the ranking, components of where that goes. The slides will be posted publicly as well if you'd like to take a look at that full report, but a sobering place to ground ourselves as we go a bit deeper. So this shows kind of a range of where some of those outcomes are stemming from. So you'll see 1 in 6 children across our state have a diagnosed mental health condition, and that ranges. High school students are reporting prolonged sadness or hopelessness, as well as suicidal ideation, well above national averages, and 1 in 7 children in our state are diagnosed with a substance use disorder. This, importantly, is statewide Nevada data. We're going to talk about what that means from a Medicaid context. So just to level set here, Medicaid covers 1 in 2 children in our state. Clark County has the highest proportion here of 3 in 5 youth in Clark County are covered by Medicaid, 2 in 5 in Washoe, and 1 in 2 children in our rural counties. Notably, 78% of children covered by Medicaid identify as Black, Indigenous, or other categories of people of color. We'll use the term BIPOC throughout this presentation. Notably, 88% of Black children in our state are enrolled in Medicaid. So there are very significant health equity implications for this work that we're undertaking. So with that context on who we're serving with Nevada Medicaid, I think it's important to turn to what do the behavioral health outcomes look like within that population. So you'll see here it's quite similar to that slide I shared earlier on what that prevalence looks like across the state. So 1 in 6 children statewide and within Nevada Medicaid have a diagnosed behavioral health condition. 80% of those children live in Clark County, which is roughly proportional to our population. 74% of children with a behavioral health diagnosis identify as BIPOC, as part of the BIPOC population. So with that kind of contextual data, I'd like to dive into a few specific areas. And this is where I'm really excited to pause. I will not be talking at you this full hour. We're going to pause after each of these and have some discussion as it relates to 2 aspects of care in our behavioral health continuum. So one is on our residential and inpatient treatment side, and the other is on our outpatient and community treatment.
What's
so
an outpatient
with all these
look
terms,
like?
I know all of us are coming to this work with a lot of different experience. I think it's helpful just to start with some level setting and some definitions. So inpatient services here, when we use that term, what we mean is short-term intensive care in a hospital setting for children with acute needs. So this is clinically appropriate for acute mental health treatment that requires 24/7 monitoring. It is not intended to be a long-term management of chronic conditions outside of crisis periods. Our residential treatment centers, or residential treatment as a care opportunity, really provides longer-term care than that inpatient service. This is housed in a live-in facility where children receive therapy, education, and support. So this is really intended to be the highest level of acuity outside of a hospital setting for conditions that are manageable through that are not manageable through regular outpatient services or community support. So that's quick context. Excuse me? maybe getting some echo there. I'll pause for questions in just 1 second. I just want to share a couple items about Nevada data, and then I look forward to the group's feedback here. So a few details specific to those types of care in Nevada. On the inpatient front, you'll see here that children enrolled in Nevada Medicaid have a 51% higher risk of an inpatient stay associated with a behavioral health diagnosis compared to the national average. So that bar at the top is the United States average of how many inpatient visits associated with behavioral health conditions there are. In Nevada, you'll see that bar is much longer. There's about 584 visits per 100,000 children. On the residential side, those stays also outpace national averages, but it's a little bit harder to get that direct apples-to-apples comparison. And so you'll see here a summary of some of our residential treatment facility data. You'll see that nearly 20% of children in Nevada, children enrolled in Nevada Medicaid, were placed in an RTC out of state, so not in the state of Nevada. And nearly 1 in 3 of those children stayed in a residential treatment facility for over a year. The average length of stay is between 9 and 12 months. Notably, Medicaid spending really skews heavily on this high acuity settings. So 80% of Medicaid spending for behavioral health services is in residential or inpatient services, which equates to nearly $38 million of Medicaid funds spent on residential treatment alone. So I know many folks here have direct experience with these programs, and we all know that the outcomes of these treatments really vary. These levels of care have a very important role in the continuum for behavioral health, as they allow for increased safety and stability and access to intensive therapy. However, there are negative outcomes associated with
negative outcomes
of these services. So you'll see data here related to high
$38 million,
and the benefits kind of plateauing as those stays continue over time. So wanted to paint the picture here to show kind of what that use looks like. And then from here, I'd love to really spend some time to reflect with our working group representatives. So we'd love to hear, you're welcome to come off mute and answer either of these questions.
Welcome.
The first being, what successes and barriers have you experienced or observed here in Nevada when accessing or providing inpatient or residential behavioral health services? And secondly, kind of focused on, as we look forward, what can we do? We are currently planning to adjust how we pay for these services, specifically for residential treatment, to really consider how we can incentivize providers to serve children with complex needs, younger children, and serving youth in a really high quality way. And so we'd love to hear, we'll share more about what that looks like in future meetings, but would love to hear, what else should we have on the table? What other solutions should we consider when addressing these barriers to high quality residential treatment in particular? So I'll pause there. Thank you for letting me share. I know there's a lot of information. Happy to answer any questions and welcome feedback from our working group representatives here.
She says she's happy to answer questions.
This is Dr. Freeman. You might have said this, but are we going to do a slide like on outpatient too after this?
Yeah, that's a good question. After this will be outpatient and community-based services. So we're starting on the inpatient and residential side.
Community-based services.
So Shar Frost has a question in the chat. She's asking, when you talk about early intervention, are you including early childhood services?
Thank you, Shar. I appreciate that question. I'm sorry that I may have missed which slide that was speaking to. So do you want to come off mute here and let me know which slide that was in reference to? Was it this slide in the continuum?
Yeah. Hi, this is Shar Frost for the record. Yeah, because it says early identification and intervention, and I was just, one of the things that concerns me is that in Nevada, we often miss early childhood, and which is a great time to get in and kind of prevent some of the longer term outcomes that we're trying to avoid.
Yeah, I appreciate that. I think we need to call that out more explicitly. I think we view early childhood as an important part of that early identification and intervention bucket, but we're also looking at how can we ensure that our services support youth at all ages throughout each aspect of the continuum. So I think we can do some more to really clarify that population in all aspects. So thank you for calling that out. I appreciate it. Yeah, Natalie?
Hi, thanks. Natalie Sanchez, Health Psychology Associates, for the record. So on the slide that we had where you had the questions, so the 1 and 2 questions, I was thinking about number 2, and we are Health Psychology Associates does do outpatient mental health. And one thing I would say from our end that would be really helpful from working with folks in the inpatient side, if there was more of a case management aspect in terms of when somebody is being discharged from those services, how are we getting that information? How can we make that process a little more streamlined and hopefully
what does that look like?
Make those stays a little bit shorter if we can, because they already do have maybe some outpatient mental health support.
Thank you. Yeah, I appreciate that. I think transitions of care are so crucial between each one of these steps in the continuum. And so we're trying to think through in our revised residential treatment policy, actually, we do have some language about what that care transition from a residential treatment facility needs to look like and what kind of support the youth and family are going to receive beyond just a single document of phone numbers. So we're thinking about that in the current policy, but I appreciate you calling that out because I think there's more we should do between every level of care and trying to connect that. So look forward to your feedback as we kind of discuss different benefits here to think about how we can embed that in each one. So I appreciate that.
They have to think about how they can embed
Alana was
that.
Next.
Hey.
Yeah, hi.
Hey.
We'll address both question 1 and 2.
So I didn't know they had this meeting yesterday. It's 17 hours ago.
How'd you miss it?
I had no idea because it just wasn't there. Maybe because we went to my nephew's graduation and he graduated from the nursing school here. It's amazing, but
wow.
Him and his girlfriend came here and they both went through the program and they both graduated.
Tremendous.
And I'm just saying that, if you choose a profession or you choose a field, then you just go to work in that area. So,
darling, you make it sound so easy, but not every place has a commercial district.
They went
I have to say things, my life experience, things just don't work that way. But I will say that it is a lot smarter to choose a targeted specialty than a broad degree.
Even if you decided to do social work, you know what I'm saying?
That would not guarantee me a job, I guarantee you.
No, I'm saying the social work that has to happen for the state is the work that still has to be done. And it has
to be done, but on an individual level, you're not guaranteed a job. But yes, the jobs have to be filled by somebody.
I say a job. No, I said create something that you can manage, where you're successful, where people are donating to what you're doing because they share the same beliefs. And here we are in a nation where people can make things happen simply because they share the same beliefs. And don't tell me it can't happen. And
I know it can happen. We see it every day.
Yeah, every day. So I don't have, it's just really analysis of how far you've come, because really it's all about you, because it can't be about me. It has to be about you. And then
it depends on what you're saying. Like when it comes down to the decision in my life and what I'm trying to do with my life, yes, that's about me.
Yeah,
but when I talk to someone, I adopted the premise that what someone else has to say is more important than what I have to say.
Oh, no, you can't. It's not about
when I'm talking to somebody, it's not about me.
Listen.
And maybe I'm wrong, but that does come from a life of depravity.
But listen.
So, but that is...
All I'm saying is that your house looks like your house because it's your journey. My house looks like my house because of my journey. And what I have decided to collect or, because it's what has been provided to me. Simply why? Because I've been on this journey for so long. I know what quality looks like, and it's just, and other people may not know what it looks like. So when I go to the Goodwill, I'm looking at quality shit. You know what I'm saying? I'm not trying
the Goodwill's great. I found a lot of good things I like at the St. Vincent de Paul store.
I mean, but it is, all I'm saying, it is one man's junk is another man's treasure, and really is how you see it, right? Because what you see, and if you can put little investment in and then take it to where you can make a benefit, then that's truly what life's about, sustaining oneself, irregardless of what you're doing. And it's kind of like, my sister, when she was in Detroit and her son, she sent her son to stay with her brother. It was an experience. He'll never forget it. right? Ultimately, her brother was murdered, I believe. You know what I'm saying? He was shot.
Mm-hmm.
But her son got to spend time with her brother that she didn't grow up with. And it's mama's baby, but it's always daddy's maybe. You get it.
Mm-hmm.
So she has lots of brothers and sisters. I have one sister, her name is Chandra Billups, but I have no idea where she's at. I know that she was born in Chicago. You know what I'm saying? But you don't know where your people are. And that's just what it is. But, early on when my father died, he just died. And it really didn't matter. William Billups, he lived and he died. And he had a father that was in Mississippi too. But his father had a whole nother relationship with another woman, and he worked for the garbage people. So I know he had some state, you know what I'm saying, some state heritage. And when I try to figure it out, well, they just didn't respond to me because, they are who they are, personal, when it comes down to it. And you don't know anything. And we don't know.
I had someone try to contact me and say that they were one of my father's kids. And I was thinking, why?
Because
why would they contact me?
Because
I was in a bad situation. I cussed them out.
Listen, you're not listening. People want to know who they're connected to. And it has nothing to do with them reaching out for money or any resources. They just want to know.
Even if it was, they still got the right to, they're still on the journey to seek.
They're just determined to understand who other seeds that were populating the world under the same concept or same, person that was shooting up the sperm. You know what I'm saying? Still connected. Like I said, I have one blood sister out there. Her name was Chandra, and her last name was Billups. And so, my father was William Billups, and he had one brother that I knew of, Sylvester. But that was in Mississippi, but then I understand he lived in a whole nother town. His father lived in a whole nother town and had a whole nother family. And I'm just saying, you will never know unless it's time. And when it's time for us to know who we're connected to, guess what? They've kept track. Don't think they haven't. They know exactly who you're connected to.
Who is they?
The system, the government who gives you a Social Security.
But do they?
Yes, they do. Social Security collects the information on who you're connected to.
Well, yeah, but in many ways, they don't really know. Like, for example, the U.S. government would have no idea who my maternal grandfather is.
Yes, they would.
No, I guarantee you they don't. That's one of the
born,
things that happened in the community that nobody spoke about.
Because
this man came and raised my mom, but that was her favorite. That was his favorite kid, but he wasn't her father. It wasn't a secret.
No, but who her father was on a piece of document on a birth certificate. When
that's the issue, that it was not, darling.
Even if it was listed,
let me tell you
Did
the
they
deal.
not do
what
that
we're
for a
wanting to
reason?
do right now,
Perhaps
what we
they
want
did
to
that for
do
a
is
reason,
go get an
because
affidavit
your skin
from
color,
somebody who was alive back then, who knows who the real father was.
And
if they sign an affidavit, we might be able to get that certified in court and then get that put on a birthing document. But until then, the government has no idea who the real father was. They think it was this other man, but it wasn't. See, so those situations, that is not an empirical.
I'm saying that whatever situation
happens,
that
type of situation.
People get pregnant because of either relationships or rape or incest. It doesn't really matter. The relationship happened, and there were people that could document that relationship in that day. And when the birthing happened, there were people in the room that swore their allegiance to whatever concept that they were participating in, whatever level.
No, darling. What you're saying, you're talking about an ideal situation. There, like in my situation, the only person who was there when I was born was some overzealous social worker from outside of the county who was ruled illegal. That she even was in that hospital that day trying to take me. That's who was in the hospital that day. It was
a financial thing.
It could have been anything. I don't know how finances have anything to do with it.
I mean, the whole thing is people pay for children. They really do.
On a black market, nobody pays for nothing. I mean, people pay for it when you talk about life in a way that, like, this is what we expect. We're the government. This is how we see
I'm
households.
just saying
Sure,
that
you can
yesterday
try,
I
but
was listening
like that
to,
situation I described to you, there's no requisite
no,
to say, well, this is
listen,
what we can expect.
I'm sorry, but it is just real. We don't know the circumstances in which we are living under simply because we were not at the table. And
Well, I
quite
know I was
frankly,
conceived on Thanksgiving.
well, happy day.
That's all I
I
know.
have no idea when I was conceived, but I do know that I was born and my mother there were 5 of us. So I do know that. And she struggled and she raised us all. And none of us ever went to any whatever, but I'm just saying, I do see that, games people play. And, here in Nevada where they have a 38% population of Black babies in the foster care system. But in California, when I know a young woman, her name was Vanessa Gillette. She was just beautiful, mixed white. She was mixed white. So I don't know what that has to say, but her family lineage was really, really just crippled. But she had relationship with this man, and her baby looked just like Shirley Temple, her daughter did. But this man took her daughter and gave him to her sister and then had her committed. And I'm just saying, games people play. You understand what I'm saying? You don't know. But it doesn't really matter. It doesn't take away the connection of that child and her mother. And the lineage, just the birth thing, just similarities, just your DNA says that you are who you are. And
Right. But see, the reality is that I am who I am, but I'm not who people might think that I am. And like I said, at the end of the day, who cares? Because I have inherent abilities. I can see, smell, and talk. That's all that matters. So there are things that I can do, and that's what I should do. I can't go out here trying to find out who I am. That doesn't matter to me because I'm not trying to be who I am. Who I was very unfortunate. So I'm trying to be somebody else.
I don't know. Whatever seeds you sow,
I do.
I think you need to understand when and where you have been successful in life and understand that perhaps that's the direction in which you must travel to be more.
I don't know about that, Darlene. I can't say I've had any success. I was happy when I was producing music and media content. That made me happy because it was my way out. I was always preparing to leave my town. And I said, there are no commercial industries of media here.
That, you remember the young man that was
so I'm going to build my own media products so that when I get to Chicago,
the guy that was
I
in
have
the room.
experience from South America, yes.
Yes, okay, he was talking about how he could market a product and he didn't have a space or a floor or a showroom. And I'm saying everything is digital and it doesn't matter where your storeroom is, it's where you place it.
That's true.
The value that you put on it, and it's the ability for you to get out there and work the soil to reap the harvest. And I'm saying it's up to you. I can't help you determine the things that you can talk about and get around and understand that's made a difference in your life. They just have made a difference. And if it's worked for you in a marginal way, it worked for you. And I can say that in my life, the resources that are available for children under special education are awesome. And maybe most people don't think that they're awesome, but I'm saying that this is America and understanding that we educate even the disabled who come into this country who are illegal citizens but have human rights in the public education system, and therefore they get food and they get shelter, they get everything. So why would we not assume that we're entitled? And I'm just saying the entitlement says, I'm going right back to say, well, how are you measuring what you're doing for me compared to what you're doing for them, as we are who we are? And I can say that.
Well, that's good. That keeps the system going. There's a lot of money on the table, and what you're talking about is a great way to pull money into a certain direction. Yeah. And that's exactly what people should do. Well, because the people that are controlling the system, Darlene, they don't have the time or the resources to see what individual people need.
States' rights says
that is nonsense to me.
States'
Yeah,
rights is
you're right
me.
about that.
I'm the
States'
one.
rights
I
have the
am the
right.
one because I showed up, and I'm sorry that you chose not to, but it's on you. What
Well,
can I
I don't
say?
know. It's two different life experiences. When
Yes,
I
yes.
get
And why
myself
would yours
legitimate,
be different? Yours would be
because
different
I
because
have a different
you were
story,
behind.
and
That's
it
right.
doesn't
That's right.
matter. Here's
That's
the
right.
issue, Darlene. Nobody can solve my
Complications,
problems. It's up
except
to
for
me.
you.
Until
Exactly.
catastrophe
It's
happens, which
just
I expect
you.
catastrophe to
When you
happen
see the
within the
train
next
wreck
year, and it's
coming,
going to devastate my family, as it always
you
does.
need to
And when that
do
happens, I would expect the
prevention.
state to do
Prevention.
what they need to do by the systems that are in place.
And
But the
therefore,
problem
you
is,
need to
once
make
that
sure,
catastrophe happens and the state does not do it,
you just need to make sure it's working for you. That's all I'm saying. Did you get cut off?
like I, like I was saying, we just suffer, and that's how it has happened historically. And it's okay. I
No,
can't
it's not
afford to
okay.
sit around
Because
being
I can
bitter
honestly tell
about
you.
nothing
No, I can honestly
because
tell you that my sons are very
I'm not trying to age anymore.
angry about their other parent, and wondering why I chose those people to have relationships with. But, people lie, and it's the things people do.
Well, that's their right to feel however they want to feel. Like,
Games,
for example,
it's
Eminem,
games
the
people
rapper, his
play.
mother died.
It's that song, games
And
people play night and day, but
people
it
play
just
games
ain't
with themselves
nothing.
all the time.
Yeah, because they see themselves
And they have
differently.
the right to. They
Everybody
have
can
the
see
right
that.
to.
That's right. And therefore I can too. And that's why
Yeah.
I had the power to step up and step out and step away and save my own soul, because that's what life is about. Saving ourselves. And that's why I said that it's reflection time. And these people in the children's behavioral health, now they're just reflecting and perhaps thinking that perhaps they should have done more work, but they didn't. And as they have not, I'm going to listen and see what they're fucking doing, because I don't think they're doing anything. But I know one thing. When I have to go to this meeting today and I have to drive all the way across town to see this woman who's a black woman who's in a position, and she's going to tell me what they're doing for Tyler, and it better be something substantial, because if it's not, I'm going to want to file a complaint against their agency for not doing shit, because they don't. But they got a job. You got it?
That's good for you.
Hey, it's just real.
That's really good.
People have to stand up. So let's listen. Let's listen to what Nevada Health Behavioral Working Group is saying that they're doing.
CCBHC, we definitely have case management that tries to coordinate if somebody is inpatient or residential. Unfortunately, it's working with other facilities. We're just not on the same page. So our case managers have a huge load and would love to contact hospitals and residential facilities and get that plan started way before they're ever discharged. And we hit huge barriers trying to get information. We're constantly told we can't talk to you. So that's been a big roadblock. So maybe educating on the different agencies and what exactly would need to be shared between each one, and having a very general ROI, which would allow communication.
1 hour.
As far as success and barriers, I think the biggest barrier is we don't have enough facilities, especially inpatient and residential, for children in our area. You cannot find anything. You really can't unless you go out of state. It's very, very hard. So I think maybe doing something with reimbursement where facilities actually want to stay in the area and we can have quality providers.
Absolutely. No, I appreciate that. I'm excited. We have a public meeting in just about a week on our residential treatment facility rates and some changes there. So I will make sure that information is shared on our behavioral health listserv. I believe it is already gone out already, but that'll be a good chance to get input on our attempts to address those very concerns. And Alana, appreciate also hearing your feedback on the transitions of care piece, very similar to Natalie there, and I think a lot more we should discuss. So I'll make sure we note that and continue that conversation. Rose?
Hi guys, sorry for the not camera. I'm having some tech issues, but I work with the Nevada Department of Education on school-based mental health grants. And we recently put out a few trainings that I did where the reimbursement procedure recently changed, I believe with AB 51, where the state would reimburse hospitals and treatment centers for the education provided while kiddos are residential.
Right, kiddos.
They can now go through the districts instead of the state. And in these trainings, we came across a lot of barriers and struggles that we're seeing that kind of impact the whole system. One, kind of like Alana was talking about, is that transition protocol.
Sorry.
I've been advocating for the FIRST protocol, which is out of UMass, to transition back into school once they're getting out of residential treatment, if they are not going into some type of intensive outpatient treatment. And a lot of the barriers that we're hearing at the center don't know who to contact, and the schools don't know who to contact at the treatment centers. There's struggles about transferring records back and forth. The reentry plans and the transition plans, sometimes there's no time to do it before the kiddo is discharged. Sometimes kids are discharged rather suddenly, and there is no time to plan. So I don't know of a solution. We're trying to increase communication between school districts and treatment centers, but we only have 4 currently that are reimbursable. There's very few options in this state. But I'm actively in contact with other treatment centers who want to get reimbursed through that track. And it is for those educational services, but it is something that they can work towards as well. So if you guys want to spread that information, that that's an option to get reimbursement, that's something that treatment centers have the option of doing as long as kiddos are there for 7 days or getting education services for 7 days. But I just kind of want to put out that we're seeing some of those same struggles and barriers on our end as well.
Thank you, Rose. I appreciate that. And our team that's working on that residential treatment policy on our end is on the call. So I'm excited for them to take back your feedback, especially on that model from UMass as well, and think about how we can utilize that in our work as well. So thank you for that.
Awesome. Yeah, thank you guys.
We'll keep going through our list. Leah?
So as a parent, some of the barriers that we're coming across, like I know with case management, I do agree that that should be addressed as soon as possible, because it does take a long time to put the referrals together. It takes a long time to get with those facilities to understand if they have the specialty treatment that some of these kids need. But also, I want it to be kept in mind that as a parent, you're still in crisis with your kid, right? So right when your kid goes into a facility, whether it's acute care or long-term care, the parent's trying to go through and figure out what steps need to be taken. So I think in all of the things that I've heard of the people that were talking before me, I hear you, I validate you, and as a parent, we want to help you, or at least I do. And with that, I think it's the parent's education too. So educating and being patient with the parent. I've been in situations where it feels like they're putting their job on me when I'm trying to do my job, be a parent, get my child through this crisis, get her through acute or residential. And it's a lot. So the more education that we can get, the better. And I think also it would be really great to have it black and white of what the expectation of discharge is, because there's so many times where I had to battle of, well, no, we don't have a plan, a safe discharge plan. I am not able to accommodate what needs to happen as a parent. So having those appointments lined up and having those doctors available and having that plan, I think that education needs to be spread to the parent of what their rights are, what they need to do, what's expected of them. Because even though our brain's not there right when you call, if it's written down, we will get to it, or at least the parents that are really trying will. In that case, if there are parents that aren't trying, I don't know if there's another sector that we can add on top of case management that would be like a counselor working together. So where the case manager would strictly work on referrals and collecting, where you would have another position that would, hey, what questions do you have? How do we support you? and, make sure that your voice is being heard. I don't want to sound like I'm rambling, but these are some of the barriers, and experiences that I've had, which I feel are important to state.
It's absolutely important. Thank you for sharing that. And I think really affirms to hear it from both a parent and a provider perspective, right? We're all on the same team to try to smooth that transition. And I think there's a lot of work we need to do to make that a meaningful and collaborative process. So thank you, Leah, for sharing. I do appreciate that. Karen?
Thank you so much, Leah. At Nevada PEP, we work with families all the time who are experiencing much of what Leah has experienced. I've got three main points. One is it's difficult, and Leah touched on it, in some cases to get in to a facility because of the child's disability or mental health issue. Typically, if there are a number of behaviors, and so then those children either don't get in or go out of state. So we have to do something. I know other states have had a no reject, no eject policy. And, I know that an absolute of that policy probably isn't workable, but the concept should be looked at. Number two is education. While youth is in a facility, hardly ever happens in a manner that they can maintain their credits for the school that they go back to. And so we help a lot of families whose children did not get credits and can't move on or graduate because they were hospitalized. So that is a big issue, and that is also part of the discharge. And Rose, talking about the model, just so you know, Rose, we held focus groups with parents across the state on that model, and really like the fact that there's intention behind planning for the youth to go back into school. And then, of course, discharge. So many families call us who have been discharged and don't know what to do next. There's no discharge plan. There's no warm handoff. It's really a shame because they really don't have the information or the support they need to come and pick up their youth. And so discharge is also key. Thank you.
Thank you, Karen. All three very important points, and I appreciate you raising. I'll also ask our team that's working on the treatment facility policy to drop the link to that conversation in the chat. I think it'll be really very relevant feedback here that we will take to that conversation. But if you're interested in even going deeper on residential treatment facilities and what our policy looks like, we definitely encourage you to join that conversation as well. So thank you for that. Dr. McGrew?
I will try not to rehash too much. I agree with everything that has been said thus far. So I'll just kind of add to it. I think the coordination of care issue is huge, both going in and coming back out. And solution wise, we might need to look at how to make that whole process reimbursable to providers in order to incentivize doing that. I know that for me personally, as a behavior analyst, I have no codes for that. I spend many, many hours coordinating care that I can't bill for. And I do it because it needs to happen, but it certainly is easier when there's a way to get reimbursed for that service. It's easier to prioritize that as a provider. And I think that we need to look at what we're doing around reimbursing the services that need to be happening. I think also I'd like to mention that there are diagnostic barriers in a lot of cases. So I've frequently seen individuals rejected because of different diagnoses that they have. But similarly,
I can't offer my services. I can't tell you the number of calls I've gotten from Texas Neuro where they want to discharge and they want like intensive behavioral services. Mm-hmm. And because there's not a diagnosis of autism attached to it, I have to say, I'm sorry, like nobody's going to pay for that. Mm-hmm. And oftentimes there, are doctors that have said like, this is, the service that we're recommending. So kind of diagnostic standards are trumping clinical judgment in those cases and are often a barrier to accessing those services when an individual might need, a high number of hours outpatient as a transition from being inpatient. So I just wanted to put that out there.
The problem is they're trying to teach to the task.
Thank you. I appreciate that, Dr. McGrew. It's true. The reimbursement piece, I think, is a really important lever for us to consider here. It is on our list as we're going through the transformation, and I appreciate the focus and push on that, something that our team will take back. And the diagnostic piece, we could spend, I know, many hours in conversation on that one, and there are many internal conversations on that as well. So I think that'll be an important topic for us to cover at a future working group as well. So thank you for raising that. I appreciate it.
I'm back. My sister-in-law, she just be calling. She don't want nothing. She says she's trying to get some money for 2 women. And I said, well, you should do whatever they do to get money. And so she was going to do it. And I don't know. She sent me a note about what she wants to say, and I have to check it out. But I'm going to finish this before I go to take Tyler to the doctor. So let me push some more play. Hold on.
Go for it.
We're not going to the doctor. We're going to this goddamn Department of Rehabilitation, but they're not giving us anything. And I'm just pissed off that we have to go out there. But anyways, hey, let's listen. Let's listen.
I think I agree with everything that everybody has said, and so I won't, keep going on that. But some of the barriers we've seen at the hospital have been just the only opportunity for us to get a child treatment is out of state. And so that's the only thing that's open. But then how do you reconnect them? And as a
you don't
acute
have
care
services
hospital,
here.
how do we reconnect them with their
they're
family?
doing the
How do we set them up for success?
That's bullshit.
And again, a lot of these kids, we had one child just recently that the only option was in Missouri. Well, Missouri, family's not going to be able to go there with them, especially in the financial situation that they were in. And that's.
Did you see that? They want to send families all the way to, children all the way to Missouri. They were sending them to Texas and Arizona, but they're talking about Missouri. Oh, no.
Just not setting up a child for success. And why we as the state of Nevada aren't doing more for our kids in our own state is what bothers me. And from another side of it, a lot of what we see coming into our hospital is parents who are exhausted, who are just at their wits' end, and they need a night. They need 2 nights. They need some type of respite care, and that's not a billable service for us either. And so as we do take these children in, and we give them a safe place to be, and we give the parents the opportunity to go home for the night and get a night off or get a moment. But that really puts us in a really hard financial position as well. And then sometimes we've seen kids that the parents realize we can't come back and get them. We're not the safest place for them to be, or it's not safe with our other children at home. And so then this child ends up staying in an acute care hospital 60 days without us really being able to provide that level of care. It's a pediatric unit. It's not set up.
That's why Nevada got punished, because the federal government said this is just not working. And you can see why it's not working, because they really don't have services. This is bullshit.
For that behavioral health care. We have decided, and permits are in place now, that we are putting in an inpatient unit. So we have a 10-bed inpatient unit and also a crisis stabilization unit that will be opening in Carson City by June. Or our hope is by June. Hopefully we'll have it done. But still, that's just not going to be enough. We know when we opened our Mallory Crisis Center, that wasn't enough. And we did that for the last 8 years of having Mallory Crisis with no reimbursement from the state. That was completely done at, we paid for it ourselves, and we know that that was a need for the community. So I think that's where we have to go. We have to figure out how do we balance that quicker? How do we get reimbursement quicker? And then how do we find things locally so that we're not separating these kids from their parents?
Absolutely. I appreciate you sharing that and all the work you and your team are doing to really care for youth and families in this exact situation. Fully agree. I'm really excited that both planned and emergency respite is a benefit that we're developing as part of this transformation, and I know it also can't come soon enough. So thank you for sharing and really reinforcing why that's going to be so crucial. I appreciate it. Matt?
Hi. So I have, again, like everybody else, these are all repeating the same kinds of concerns. The other one, is my fellow behavior analysts and parents can tell you, is that frequently we run into barriers on the residential side, where right now the coding restrictions as enforced will often end up being for some of the kids who, either as part of the step-down transition to be able to get out of a residential setting, or even just to be able to be successful in an in-state residential type of placement, especially for a lot of our diversionary court kids who also have an autism diagnosis or an FAS diagnosis, etc. Generally speaking, that's not billable, or the billing as Medicaid has it conflicts, even though we can do it with commercial insurance. And so that creates a whole bunch of places where we're not able to get in there and do the things that would provide that better level of support and probably ultimately reduce the cost. And it's a concern to me always when commercial insurance and even managed care options of Medicaid are providing better services or better access to care than what fee-for-service Medicaid is willing to allow or authorize when they put in substantially significant limitations, even up to and including the whole, and again, the behavior analysts and parents who have kids who are, like myself, who are receiving ABA therapy, the rolling 7 days to do 1 hour of parent training with a nonsensical explanation of why that limit is there, that is not present for any other funding source, creates, again, that push into some of the clients ending up in residential care and needing higher, more intensive services for longer because of barriers that are discriminatory, essentially, on the Medicaid side because they aren't present on the commercial side.
Yeah, thank you, Matt. I appreciate that. And that is actually a topic that our team that's looking at the residential treatment policy has been discussing, and I think that will likely be something of discussion at that policy workshop next week. So I appreciate you raising those discrepancies is something that our team has noted. So we'll look forward to more conversation on that, but I appreciate really how that you're tied to how that leads to longer stays, which we know are not associated with those outcomes and appropriate transitions that we're looking for. So thank you for raising that. I appreciate it. Dr. Freeman?
Thank you. I just wanted to quickly comment on barriers for the families that we serve at the Boys and Girls Clubs. Barriers to mostly what we've experienced in our role is helping families access IOP and PHP. And a lot of times transportation is a barrier if the youth wants to get there in person. That's been problematic for the families that we serve. And then we've had a couple of requests Could we like supervise an online PHP IOP because the parent has to be at work during the times that the youth is supposed to be in the program, and we just, like, as much as we want to do that, we don't have the resources to do that safely, so we've had to say no. So I just, for families who have significant resource limitations or multiple system needs, just some like really basic barriers like transportation can prevent the youth from being able to access the program.
Thank you for raising those, Dr. Freeman. Agree that those are some of the really challenging, but hopefully more addressable barriers that we need to really focus on through this transformation, specifically on that transportation set. That's what comes to mind for me first. And I also appreciate you raising PHP and IOP to avoid our alphabet soup of acronyms. That's partial hospitalization programs and intensive outpatient programs. I'll note that those are not called out in this data here. This is kind of a summary on two aspects of a high acuity, and the middle section we don't have data on today to really present, but I appreciate you mentioning those. Those will get a lot of time and attention and discussion in future working groups as well. So thank you for raising that. And I think we'll conclude with this section with Jessica.
Hi, thank you. I just, in follow-up of everything that has been said, especially regarding like the safe transitions for family members, I did want to just note that we have seen an incredible increase of families from a human services agency, from a CPS perspective, where we're getting reports both from families and also from providers who are basically, saying like these families are not willing to come and pick up their kids, and families are calling also and saying like, we're not trying to neglect our kids, we're not trying to not pick them up, but we don't feel like we have a good safety plan. We don't feel like we can keep the rest of our, family youth, ourselves safe. We don't have a provider. We don't know where they're going to go to therapy when they leave. Sometimes it's, we're from the family's perspective, and I know, in digging in and working really closely with our hospitals around here, this is not always, it's not always 100% either way, all or nothing, but some families feel like they're given, very little information and very little transition time, to the point where they feel like sometimes their only option is to let, their children come into a child welfare system, which is definitely not the best case for anybody, especially from the perspective of then the services aren't any better because their kids are in child welfare. And so if we can really work on all the things that have already been said, but I just thought it would be important for me to mention that because of all of the things that have already come up, that we really are seeing an influx of kids coming into care because their parents don't think that they can meet their behavioral and mental health needs, or don't feel.
Okay, I'm going to say something because the parents really cannot meet their mental health needs. They have to have a plan. And that's why, it's called an IEP. And the public school system is called an individual educational program. And the federal government provides money to states. And you know how they do it? They say, take it off your allocation that we give you for everything. And they say, for everything? And they say, yes, for everything. So it really doesn't matter what services you're going to be entitled to, because it's a we the people kind of thing. And it's just we the people. But if you don't believe it, what can I say? Because
it's better to believe it. It doesn't cost anything.
Because that's all you can do, believe it. But when you go back and you listen to how they don't want to see us as citizens, how citizenship is crucial, but this is 2024. And I'm not going to distinguish my rights from any immigrant that comes in yesterday. They don't have more than me. You get it.
You got the right president in office.
Well, hey, and it really doesn't matter which president is in office, because it is who we are and what we believe as we the people are relevant. And that's the relevance of it all. Let's finish hearing it because it just got a little bit more time. I mean, but come on now. They didn't have a meeting to talk about what? Why they have their jobs, why they are employed, what is the obligation. Come on now. And just understand children's behavioral health working group. They're employed to do what? Create a pathway for who? Well, I thought you knew. Let's just listen.
Like they have the appropriate resources when being discharged from higher levels of care and acute facilities.
Absolutely. I appreciate that, Jessica, and I agree that is fundamental that is one of the most core problems we're trying to solve with this transformation, right? No family should ever have to give up custody of their child to get them access to the care, and I appreciate what you're sharing, which is you, from that perspective, are doing all you can to provide that care, and it's really challenging when it looks very similar on both sides of that coin, so thank you for sharing that. So in the interest of time, we're going to move forward to our outpatient and community-based services section. I appreciate all the engagement, and there's so much that we're going to continue to get into here. So if there's other things to add, we welcome those, both in the chat and in future meetings as well. So as before, we're starting with a quick definition of what do we mean when we say outpatient and community-based services, really looking at those that are provided within our community and other behavioral health clinics and locations that do not require an overnight stay, really meant for ongoing support, care transitions, and mild to moderate needs that don't require 24/7 support care. So as many have touched on here, there's a number of positive outcomes linked to these treatments when used in the right place at the right time, including reduced hospitalization, stronger focus on family-centered care, and higher cost effectiveness as well. The challenge, of course, as we all know, is that access to these providers in Nevada is much lower than national averages. So again, that same Mental Health in America report, Nevada ranks 45th out of 51 states in DC for access to behavioral health care, and every single one of our 400,000 children in Nevada covered by Medicaid live in an area with a shortage of behavioral health providers. Every county in the state is considered an area of behavioral health provider shortage. I know that's not new news to anyone on this call. I did find this data from our team, our analytics team, to be really helpful. It's a map. I know the numbers are a little small, but it's a map of where our current providers are enrolled in Medicaid by county. What this averages out to is one outpatient behavioral health provider per 100 Medicaid recipients. And I'll note that, as we all know, based on the geography of our state, just having a provider in your county does not mean that it's an accessible provider, of course, right? Many barriers to access, ranging from transportation and scheduling and availability. So again, reflection on this side, on the outpatient and community-based services side, successes and barriers, welcome feedback there. We've talked about in our last meeting some of those array of benefits that we're looking to develop, things including peer support for families and youth, planned and emergency respite care, wraparound facilitation, and other intensive in-home supports. And wanted to really open it up, since it's been a month since we last shared that list. Curious if there's anything else that this group would like to share as things that we should consider to really increase the availability and robustness of these services. So I'll start with Dr. Freeman.
I'm not sure if this is exactly what you're asking about, but it's really relevant for us. We do a significant amount of preventative services, like mental wellness, social, emotional learning, and by giving youth that foundation, we're increasing the likelihood or decreasing the likelihood of them getting on a trajectory to needing more higher intensity level services. And I'm not aware of any way for us to bill for that time. And so right now it's a gap in my budget because we don't, like someone else who mentioned a lot of time doing care coordination. We do as well. Some of that time is billable as case management, and some of it's not, but the benefit to the family and to the system as a whole, there's like return on the investment of that time on our part to the system. And so I think that's a gap that potentially could be addressed.
Thank you for that. Yes, we will note that and see what we can do on our side. So I appreciate that. Natalie?
Hi, thank you. So I am lucky enough to belong to several different consultation groups with a bunch of different providers in Washoe County. And so I went back to them after our last meeting and said, I have a little bit of a poll because I'm the only one out of a group of 35 that takes Medicaid. So I wanted to know, why is that? What are some of the barriers? And so some of the big things that folks were indicating were that, the big one, reimbursement, that it is not cost effective for them as an agency or as a private practice clinician to take Medicaid. The second thing is, we talked about it last time, really the administrative costs. And then one of the the third thing that everyone kind of spoke to is that it's difficult to take Medicaid. And in particular, if you're taking an MCO, that you don't have a representative or somebody who you can talk to and someone who can follow through on something. So oftentimes a really challenging or difficult case might get lost in the shuffle. And also you're not getting reimbursed for that time. So again, it kind of goes in this massive circle. And, I think if there was a way to make this more attractive for folks, because there are a lot of providers out there and there's a lot of really great providers who I think are doing some great things for kids and families, but given these barriers aren't willing to take Medicaid, and then hearing the movement to the MCO are really saying, no thanks, I think I might drop, and I won't consider it at this point. So
thank you, Natalie. I appreciate that. And I'll share and kind of how we're organizing our transformation work internally. We have, of course, folks working on our delivery system and our benefits, and there's a whole body of work we have related to our provider experience, enrollment, increasing access, and decreasing administrative burden. So I appreciate you sharing those, and I look forward to getting that full list from you and the rest of us providers as we really dig into the weeds of that work. So thank you. Gwyneth?
Good evening, everybody. This is Gwyneth from Clark County. I just wanted to kind of second what I have already heard in the discussion with respect to the importance of respite care services. And I come at it from the perspective of the DA, who's assigned to both dependency matters as well as delinquency matters. And there was discussion of the increasing influx we see of families in the community who come into those systems, not because they're really meeting the definition of neglect, but because they can't kind of safely maintain their children in their home. And I just think having robust, accessible respite services is so important for these families, either families of origin who want to maintain their child, or I can think of several recent cases where we were very close to adoptions proceeding for a child, and those adoptions are no longer occurring because that prospective resource said, in the absence of really having a solid understanding of respite care for this child with extremely high level need, I'm not comfortable proceeding. And that's just really a tragic outcome. So I view respite services, as Karen has mentioned, both emergency but also plan, as a game changer if it can be effectuated. And I say that knowing it's not an easy system to establish or fund or set up, but those services are very, very important.
Absolutely. It will not be easy, but it's critical, and we're really eager to move quickly and do it the right way. So I look forward to your feedback throughout that process, as well as the rest of this group's here. So thank you for that. And Dr. McGrew.
Yes, so I would definitely second on respite care. That's a critical need throughout the state. But I think also getting creative about kind of family and caregiver education. There are some really solid systems in and around kind of crisis management and de-escalation that, if they could be rolled out in a more systematic way, would also give families the skills to cope and to kind of make it through, from crisis to crisis without seeing kind of maximum, escalation and crisis in what they're doing. And that overall would lower their level of stress. So I know that when I've done this sort of training with parents, just the confidence that it builds, and the kind of breathing room it gives them because they have a skill set in that area can be important. So we're threatened with a huge provider shortage in this state. Like, so much of it is resource constraints, but pushing out those informations and skills in a structured way can also be of benefit.
I appreciate that. That's a really important point. How can we think as creatively as possible about addressing this provider shortage? And that could be a really important way to do it. So let me make sure we take that back with our team and see kind of what other national best practices look like across the country as well. So thank you for that. So we'll continue to move forward here in the interest of time, and definitely welcome others to chime in the chat. I think I really appreciate what each person in this group has shared, including personal experiences with their family or loved ones. But I do always want to center this truly on those that we're serving. And this quote here is from a parent of a 14-year-old in residential treatment in Nevada, who's covered by Medicaid, and really shared how challenging that experience was for them, and how crucial it was to bring those services back in state and really to keep him at home and in his community wherever possible. So I know reflected by many on this call, but I think it's an important thing for us to really continue to focus on as we move forward through this work. So in closing here, I know just a few moments left, and I do want to save time for public comment. So I'll conclude. This is a slide that you have seen before. This is really how we're viewing the rebalancing from current state to future state. Each part of that continuum being crucial, but trying to really right-size the availability and access of benefits across the full array. So I look forward to sharing more about one of those benefits in our January meeting here. So I'll teaser for what I'm going to share in just 1 second. I do want to call out, these are a few questions that we did not get a chance to cover today, but I think are really crucial. And we will revisit this at an upcoming meeting. In particular, question 3, thinking about how do we measure the success of our transformation, right? We've seen data today that really measures where our system is failing, and those things are not surprising to any one of us on the call. But I think what's really crucial is to think about, as we build something new, what are the metrics that we're using to tie to success, and measure whether what we're developing is actually working for our youth and for our families. So I'd like to leave you all with that question, food for thought. Feel free to shoot me and our Children's BH email a message if you have any initial ideas, but we will come back to that for a broader discussion. I think it's a really important part, right? There's one thing to look at data, and there's another thing to really use it to measure our success. And I don't want that piece to get lost. But I want to thank you all for your feedback and contributions today. It's really helpful and reassuring to hear the range of perspectives that we're bringing, and I'm really heartened by the folks that we have to do this hard work ahead. So speaking of what's ahead, I want to call out our next meeting. So our next working group will be January 9th, 4:30 to 5:30 p.m. As I mentioned, we're really going to be diving deep on those home and community-based benefits. First, we're going to talk about what is a Medicaid benefit? What does it mean to develop something as a Medicaid-covered benefit, and kind of open up the hood to show what that process looks like internally. And I'm really excited that we'll get to focus on family peer support as the first benefit that we're tackling. I want to thank Karen and Nevada PEP for all their partnership in over many years to get to this point, and we're excited to kind of share with this group what that process has looked like and what our path forward is, and to get your feedback on how to build it in a way that really works for our community. Our February meeting, the date and time are TBD. Thursday evening spot works for the majority of our representatives. This is based on feedback you all gave, and I appreciate it. So we will just take one more moment to adjust before this gets set in stone. But we'll begin to really talk about our psychiatric residential treatment facilities as well as our specialty managed care plan. So a lot of work ahead. I'm really looking forward to doing this all together. And with that, we will turn to public comment. So definitely at this time, we will offer that opportunity for public comment. As a reminder, no action can be taken as a result of public comment period unless it's specifically included in the agenda, but we welcome feedback from those public members of our community on everything that we've discussed today. So Charlotte, we'll start with you.
Hi, and thank you. First of all, I want to really thank everybody for all of the responses that have been given. There's a lot of work here to do in Nevada. But when you were talking about data metrics that would be helpful, I think one of the data metrics that would be helpful is we do have a Children's Mobile Crisis Response Team. And one of the data metrics that we have not been capturing has been around how many of those responses are happening for families and children and youth who have not previously been encountering the mental health system. This is obviously like a really important thing for the consortia and the policy boards to know and understand as we move forward with making recommendations. Because the families that I've worked for or worked with in the past when I was with Nevada PEP, many of them, this was their first introduction to mental health. They had no clue that this was coming or how to respond or what to do in response to all of that. And I put in chat earlier that one of the barriers is that families just don't know what they don't know. And if they don't know what to look for and there's no outreach done to inform them of what's available and what they could be accessing, that's really a problem. So I'll leave it there, but thank you, Anne.
Thank you. That's great feedback. And as we build a no wrong door system, we want to make sure we're both connecting those youth and families appropriately to care and tracking where we can try to intervene earlier and provide support to you. So thank you for that. James?
Yes, thank you. On the previous slide that you had mentioned an RFI for the specialized pediatric behavioral health plan, when does the division intend to release that RFI?
Yeah, thank you for noting that. We intend to release that after the holidays in the new year. So we may not have the full responses to share with the group. I think that was actually a leftover bullet from an earlier conversation. So thank you for that catch. We will cover it either in February or in future dates, but we look to release that. Thank you.
Great. Thank you.
Yeah. Kim?
Just really quickly on the barriers to the inpatient services and the residential services, one thing I wanted to flag is we really have a hard time sometimes getting kids admitted to programs, particularly if you have a variety of needs. Our dual diagnosis youth who have intellectual and developmental disabilities in addition to their significant mental health, it's very hard sometimes to get them admitted into programs. And unfortunately for some of our kiddos who have been in and out of care multiple times, they end up on, a better phrase, like a no-fly list, where a lot of the acute hospitals don't want to accept them because of their behaviors. And we end up in situations where kids are stuck in emergency settings. We also had a situation about a year ago where a youth in detention who was highly acute, we could not get her admitted into a single acute hospital in Clark County. She ended up having to be driven by ambulance all the way up to Reno Behavioral Health, and that's just simply unacceptable as a way to get acute care for a youth in desperate need. And so figuring out a way to ensure access to acute care, despite the fact a child might have a history or significant behaviors, is hugely important for our kids in crisis. And then similarly, we run into those barriers in residential treatment when there's any other complication in addition to the mental health. So kids with mental health who also have diabetes and need a program where there's going to be nursing on staff to handle that, or kids who have a dual diagnosis with substance abuse. So not only do we have a shortage overall of the programs that we need, but having programs that will accept the full child. And this goes to, I think, part of the comments that Matt was making too about access to ABA within a regular treatment setting, those sort of things. So that's a huge issue that we see as a barrier for kids.
Thank you for sharing, Kim. Yes, I believe we will spend significant time in this working group talking about how to best serve our population of youth with dual diagnoses. They are a crucial part of this transformation, and we know that they have very distinct needs. And we need to think about how we're designing our system accordingly. So thank you for sharing that. I appreciate it. And Jonathan.
Yeah, thank you. I guess I'm wondering, I feel like this work has started because we know we're not doing a good job for our kids, but also because we have a case filed by the Department of Justice against Nevada. And we've been being told for over a year now that settlement is like on the verge of being public. So right now at this point, we don't know any of the scope of that settlement. We don't know any of the teeth in the settlement to ensure that we are living up to our obligation. And so it's really hard to have this discussion about change when we don't know, we're relying and we're being told that this is being developed, but it's been, over 2 years now since that complaint was filed. And then I think a lot of times when I'm thinking about MCOs versus fee-for-service for our populations that we serve at, CAP, and, Gwyneth works with, I think of how have we done with other populations that have transitioned into MCOs in the past? And do we have a track record of showing that that has gone well for those populations? So I'm thinking of the Medicaid expansion that brought in folks who are 138% of the poverty line. And do we have a track record of serving those folks well that tells us that, yeah, we can do this in this setting? And then I just want to learn more about why will MCOs be different? We all know we have not enough providers and everything we've talked about on this call. So why is that different in the new world we're creating? And, I'm not there yet. Like, I don't understand that step.
So Jonathan, this is Stacy. To your first question, I can't speak to that DOJ agreement. It's confidential. See, I think you know that. I will tell you what we're doing is in alignment with that, and we're moving forward regardless of that. The teeth here is that we are doing it. We don't need a court order to do the right thing. So I just want to start with that. We have funding for the first time ever too, that we haven't had in this state. So that also is driving a lot of this. That if we had, it wouldn't even matter right now if we had the agreement. If we didn't have any funding, I wouldn't be able to do anything. So that's number one. Number two, for the managed care plan, I hear you, but this is not your typical managed care plan. I've tried to say this a couple times. It's a specialty plan designed and focused on behavioral health needs for these children. Ohio Rise is doing this. They're nationwide, one of the best practices, at least from our perspective in Medicaid. We're looking at modeling what they're doing. The piece on the fee-for-service side is we are not equipped as a state to manage every case. We cannot have enough case managers. I mean, I know the counties struggle with this, but if we expect that we're going to be able to deliver that type of care at the state level, I can promise you we're not going to be able to staff it. And so we've got to figure out a better way to do this. We're not looking at a fully risk-based model, and I'd like it if we could table this conversation to the day we do talk about managed care, because we are going to have a full presentation on that. And I think that's the opportunity where we can think about, we've got to do something different, Jonathan, because I can promise you fee-for-service is failing. And that's what we got now. And if we continue down this route, I can put all the money in the system and we're not going to see anything. So we've got to think about something different. And I get, maybe it's a hybrid, maybe it's a little bit of both, but we've got to think about something else to actually ensure that we're tracking quality, that we've got money on the table. Managed care plans have money to put on the table that I don't have as a Medicaid program. And so those are the kind of things that I want to use to drive into doing better. So I would appreciate, I think when Ann has the managed care conversation, if we could table some of that for then, and then maybe, Ann, we should do that right after the RFI so we can make sure that that's informed and people have what they need to actually respond to that RFI. So I'll stop there. Thank you.
Absolutely. Yes, we do plan to have a dedicated conversation to the design of that plan. So look forward to having that early in the new year. So thank you, Stacy, and thank you, Jonathan, for your comments. I appreciate you all for staying 6 minutes over late on a Thursday evening. So thank you all for your time. If you have any questions or feedback for our team, you can reach us here at our Children's BH email address. We thank you for your feedback and your time with us today, and we really appreciate it. So take care.
So you see why I missed it, because they just uploaded this 18 hours ago. But she said that this was on a Thursday evening, so this was not a live replay. And there was no way that you could even participate. But that's okay, because what they're going to understand is behavioral health is human development, and human development is behavioral health. And that's what it's all about. We're not talking about anything else, just free and appropriate and what it looks like, because I became a citizen when I was born, not yesterday. You get it, right? Because it's okay. They could come in and take the oath of citizenship, and then they could talk about their perception. But it's your perception that's never in the room if you never show up, right? Right. And guess what? You can log in online, just like I just did and shared with you. They've got so many damn committees. But it's like the head is connected to the neck, and the neck is connected to the shoulders connected to the arms, and all the way down. We just connected. So anyways, I gotta go. But thanks for showing up, and hey, all of this stuff is online, but if you really go to the CDC, your headphones are messing up. That's okay. But I'm just saying, when you go to the CDC's website and Watch Me Thrive, 0 to 5, it's real, because everything that a 5-year-old should be doing is listed there. And then there are other places it tells you to go, where to go and find out where you should be when you're in the 8th grade or in the 7th grade or the 6th grade. On all 4th grade nationally, people will be scoring where and what. And I'm saying pimping ain't pimping, goddamn. GOTDAM is not God. It's just GOTDAM. You get it. But anyways, the CDC is a great resource, but I gotta run, and I will catch you later after I go into this meeting that's a joke for me, but apparently is this black woman's job, and I need to understand what her job is, because they didn't put her on me. You understand what I'm saying?
Housekeeping, please keep yourself on mute. We'll have the ability to talk with one another at the assigned breakout times, but we really encourage you to post questions and reflections at any time in the chat. I want to let you know that this session is being recorded. And so as we begin, we'd like to do some quick polls with you that should appear on your screen. Bring those polls up. So if you could take a few moments and complete these polls for us before we officially begin. And thank you for completing those. You can see those coming up at presenters. And give you a moment or two. We've had only 7% vote, so I'm waiting for a little longer. And thank you for typing your information into the chat as well. Really appreciate that. Nearly up to 50%. Thank you so much for doing the polls. Okay, let's publish those results and we'll move forward here. So we can see the results for those who did the poll. Everyone is allocating resources, and we see the preferences that folks are thinking of. So thank you so much. We'll just move forward here. And Jonathan, over to you.
Thank you so much. I believe the superintendent has joined us, and she will give us some opening remarks. Superintendent Ebert.
Good morning. It is so great to see
May 4th,
most of your faces.
2021.
I see a lot of, there's Augustus. But for those of you that I haven't seen in a while, it is great to see you. And I'm really pleased that WestEd once again is partnering with us to help move the state of Nevada forward in a strategic way, and to make sure that our teachers, and I know Christy just got a warm heart too when she saw the social emotional component that you all are working on. But there is a lot of work to be done. We know that. And we also know that we can be extremely strategic with these new resources that have been made available to us. So with that, I know we have a lot of questions and a lot of information that's going to be provided. So with that, I'm not sure who I am turning it back over, but thank you for putting up our Battle-Born and Globally Prepared and our path forward with COVID-19. I appreciate that as well.
Thank you, Superintendent Ebert. My name is Mary Peterson. I'm the co-director of the Region 15 Comprehensive Center at WestEd, and we serve the states of Arizona, California, Nevada, and Utah. We are one of 19 federally funded regional comprehensive centers, and our main focus is providing technical assistance to the state education agencies in these 4 states. Today's agenda is once again packed full of good information, but also time for you to discuss and figure out the implications of the information for your particular context. We'll start out with unpacking the American Rescue Plan Act, and Augustus Mays will do that, and we'll introduce Augustus and Jason in a minute. Then we'll have time for question and reflection. After that, we'll hear from Jason Willis, and he is going to talk about how to align LEA support to meet school needs for reopening. And then we'll again have that followed by an opportunity for you to reflect with some discussion questions and ask questions of our 2 experts. Next. So here are our objectives. We hope that by the end of today's webinar, you'll have a better understanding of the American Rescue Plan, or ARP. We hope that you will also have some new ideas that will inform your strategy for allocating and using the ARP funds strategically and effectively, and that you will have time to talk with your colleagues about what they're thinking and share your best ideas so that Nevada uses this amazing amount of money to make the best possible progress for our students. This is a once-in-a-lifetime opportunity.
The one thing I can say is they had so many meetings publicly about using this federal money, as if everybody understood the rules regarding the use of the money. And no one was told the rules. They were thinking awesome, creative ideals, and they did whatever they thought. Now let's see how it worked for them.
We're probably, hopefully, not going to get it again because of pandemic. But this is an opportunity to really take a look at what we've been doing and leave behind what we know didn't work and start doing some things that we know will work. There's a lot of attention on this because it's such a huge amount of money. So we really need to succeed and make sure that we effectively apply these funds to close learning gaps, make up for lost learning, and do the very best for the children of Nevada. So with that, I'd like to present our presenters. Jason Willis is our Director of Resource Planning at WestEd, and Augustus Mays is Director of Government Relations at WestEd. They bring great expertise to the table. I hope you'll take advantage of the opportunity to ask them questions either in the chat or during the question and answer period. They have an amazing amount of information about ARP, and I hope you find it useful and beneficial to your situation. So with that, I'll turn it over to Augustus.
Thank you, Mary. And thank you all. Good morning. Superintendent Ebert and the team at Nevada Department of Education, thank you for inviting WestEd and the Region 15 Comp Center to provide supports to your districts and schools across your state around, as Mary said, this historic and unprecedented opportunity to leverage the federal resources that have come through the American Rescue Plan, CRRSA, CARES, and really leverage that to accelerate learning for all kids across your state. So I'm going to share my screen and begin my presentation. And Julie and Dell, you can see my slide?
Yes, thank you.
Perfect. And so again, we met with you back in March. And at that time, of course, it was just, maybe a month, 2 months out of the CRRSA Act being passed. And I had indicated and flagged for you all that the Biden administration, as well as Congress, were working on one final relief package to support states and districts in transitioning from, dealing with the adverse effects of the pandemic, especially around helping schools pivot to different learning modalities around sort of, virtual learning, hybrid models, and really start to sort of shift from just the immediate response and rapid response of what school systems were doing in responding to the pandemic, and really start to pivot towards sort of leveraging these one-time resources to be more sustainable in the long term in addressing, unfinished learning and identifying evidence-based strategies that could help, close learning gaps, as Mary had mentioned. And so now we're at this point where we can now sort of talk and reflect about the American Rescue Plan and its historic investment, because already the state of Nevada has already received 2/3 of their funding. A third of their funding will be coming along as they submit their spending plan to the U.S. Department of Ed, which I'll get into later. But I think it's time for us it's good for us to start and have this conversation, just reflecting on where we've been and where we are right now. So the American Rescue Plan, as I said back in March, was passed by Congress. It's $1.9 trillion in emergency response aid to address, the adverse effects of the pandemic. This bill has $220 billion in education aid. And so when I say education aid, I'm talking from early learning all the way to post-secondary. But the majority of that funding is targeted towards K-12 education. $130 billion of this aid is going towards that. And as with CRRSA, the American Rescue Plan, or ARP, is really intended for state and district leaders to use these funds, as I said before, to address short-term needs associated with the pandemic. So again, that could be, upgrading your facilities, providing one-time summer programming or enrichment programs for students to bridge them into the fall. So sort of short-term needs, but then there are structural changes, right? More long-term changes that Congress and the Biden administration is hoping that, systems will make in terms of the programming and supports that they provide that are more long-term and sustainable and are equitable and really whole child focused. So to give you a perspective of the unparalleled investment that we're seeing right now, this slide sort of shows you on the right, you can see the three packages, right, that have been distributed to states and localities, again, across the education spectrum or continuum. So you had $35 billion under the CARES Act, which was, $13 billion went towards K-12. You had CRRSA, which was $93 billion in total, but $54 billion went towards K-12. And then ARP, $220 billion, as I said before, $130 billion is going towards K-12 education. And then you look to the left, you have the American Recovery and Reinvestment Act that was passed, right, during the Obama years in 2009 in response to the Great Recession, which in total was $100 billion. So you take a look at the $348 billion that we're receiving now, that has, come to all of us. And I'm sure all of you are pleased by the investment and the focus that the federal government has provided all of us to address the needs of our schools, students, and communities, but also probably feel a little overwhelmed because, again, these are three, large packages that have hit your doorstep in terms of funding that's available to you to address all of this. The one key message that myself and Jason will want to convey to all of you is that even though this is probably overwhelming in terms of the amount of funding that's, available to you right now, the important thing is to remember you don't have to spend it in a hurry. The important thing is to make sure that you are all, as I know you are doing, making sure that you're focusing on how you want to sequence these resources to address, like I said, sort of the one-time needs, funding, needs, or address other needs that you have that are more recurring. And so, again, as we've been sort of communicating throughout this series, it is an unparalleled investment. It's a lot of funding that's available to districts and schools right now. But if you take the time to sort of identify through your needs assessment, your stakeholder engagement with your schools and communities, and then identifying how you want to strategically roll those funds out to your schools to support learning recovery strategies. We will hopefully, 4 or 5 years from now, be able to point to the progress and impact that we had through these dollars. So on this slide, again, it's just a further breakdown just to get, as I've gone over before, of that the $348 billion that was going towards education in general. And I really drill down here just on early learning in K-12, which are the major investments that are available. So in early learning, there is in IDEA Part B as well as Head Start major investments to support kids who are 3 to 4 years old, or for those states or districts that have preschool programs. These are resources that you can really leverage to support those efforts. Again, in the K-12 space, there's $130 billion that includes the ESSER fund or ESSER 3 fund, but also that funding pot that I'm pointing out here also includes the investments, almost $2.5 billion that's going to IDEA Part B, as well as other investments that are made to BIE and other outlying areas. And another major component that of funding that's available to districts, right, is around the E-rate program. So there's $7 billion that goes to that. So connectivity was, of course, in the early phases of this pandemic, very important around digital equity, especially around access, right? But we all know just access to a laptop, access to a broadband, although essential, isn't the entire picture in terms of making sure that students have an equitable experience in terms of the education that they're receiving. And so professional learning also around distance learning could be an investment that a lot of districts like yourselves might want to invest in leveraging these resources towards to support teachers in inclusive practices in terms of how they deliver instruction through that particular modality. So there's also an opportunity there through this American Rescue Plan to continue a lot of the work that you all have done at the district and building level around addressing digital equity. On this slide, I'm just sort of giving you a broad picture of the similarities and differences between CARES, CRRSA, and the American Rescue Plan. So the similarities, right? The major portion of the funding that's going towards education in general, of the $220 billion I had mentioned before, is going towards the Education Stabilization Fund. And as you all know, the Education Stabilization Fund is broken up between K-12 and higher ed. So the K-12 portion, just like in CARES and CRRSA, is going out through the same formula, that states have received in the past. So based on their state's Title I share, Title I Part A share, they receive their allocation through the Educational Stabilization Fund that goes directly to the ESSER fund, which you all are familiar with. And so those resources, again, go out in the same way in terms of distribution, as you all know, that was established under CARES. The major differences between CARES, CRRSA, and the American Rescue Plan is really what I think held up the American Rescue Plan from being passed last year, which is there's $350 billion. So in addition to the almost $123 billion that's going towards K-12 schools in the ESSER fund, there's also an additional $350 billion in state and local aid that go directly to state and local governments through the Coronavirus Fiscal Relief Fund, or the CRF fund. And so that was a big sticking point, right, for Congress in terms of the effects of the pandemic was a little uneven state by state, depending on your tax base, depending on your individual respective economies. The pandemic affected state economies in different ways. And so a lot of congressional members were there was already a huge investment through CARES and CRRSA to the education space around funding. And so they wanted to see the impacts of that. But also they wanted to make sure that state and local governments truly needed that additional infusion of funding coming from the federal government. So in ARP, there is $350 billion going to state and local governments, including the state of Nevada, by formula to receive some additional assistance outside of ESSER. Now, of course, a lot of that funding will be dictated by, what happens in your state's legislative session and your budget process, and how those, that funding will be tied to education. However, it is another opportunity there that wasn't, present in the CRRSA package. And then the last thing in terms of major differences is, again, there's no Governor Emergency Education Relief Fund. You will recall the GEAR Fund allowed governors, to distribute funding across the education continuum in their state to add additional aid to state and local school systems. And so Congress decided to invest the majority or all of the funding and target it towards the ESSER fund, as opposed to giving governors some flexibility on how to use those funds. So those are the similarities and major differences between the packages. So here's a slide that just shows you, again, sort of how the ESSER fund, ESSER 3, is allocated this time around in more detail. So as I said before, there was about $123 billion approximately that goes to SCAs via their Title I share. Before they can distribute it to LEAs, they also have to reserve $800 million to homeless students. Again, that's Congress recognizing.
Did you hear that? $800 million reserved for homeless students.
Families,
that's at McKinney-Vento. But unfortunately, we still have homeless.
Lost their job and therefore lost their home. And so many students who weren't homeless before the pandemic have entered into that unfortunate circumstance, as well as just making sure that the students who were designated as homeless students prior to the pandemic are continuing to receive the necessary wraparound services that they need from their state education agencies and the school districts. And so $800 million has been set aside for wraparound services. The Department of Ed has released 25% of that funding already. And the remaining 75% will be coming out hopefully later on this spring, early summer. But that's a major investment to focus on homeless students' education. And so that's one obligation that states have to make. Once that obligation is made, then 90% goes directly to LEAs, right? In sub-grant allocation. The difference again between CRRSA CARES, which again goes along with the theme that I mentioned before, and under the American Rescue Plan, 20% of the resources that you all receive from the Nevada Department of Education through your sub-grant allocation has to go towards addressing learning loss. And again, the American Rescue Plan has a broad definition in terms of how it sort of...
You see, it has to go against learning loss. So those dollars that are spent should be spent in the community where children are missing out on educational achievement. And we're just wondering how it's working because we don't see it working. I didn't see you yesterday. Yeah, I was talking.
Yeah.
Yeah, what's up?
I'm just coming out the bathroom. That's it.
All right. Well, I'm just talking and running my mouth.
No worries.
Is everything good? I think we should put some more cream on your hair and just brush it, and then perhaps put one of those.
Sleeping caps.
Yes.
If I can find one again. I just misplaced mine.
All right. Well, we'll find one.
Well, whenever you want to do the cream, just let me know. Okay.
Okay. Did you eat?
Yeah. Like I was just in the bathroom.
Well, please, did you check?
I already checked.
And what happened?
There's nothing there.
Nothing there. And so you need to email your accountability person.
Okay.
Please do, even if it goes into the general box. All right?
It's not so much an email, it's so much just a text.
We'll send it on because I want you to stay in this program. And I am who I am, so I'm not going to change that. But it should not affect you being in the program. What is he saying? Dang.
Alright. For now, I'm just gonna get something to eat.
Huh? For now, you're going to do what now?
Something to eat.
Yeah, I made chili. It's real. Okay. And?
Did he want to call you at any point?
Huh?
Did he want to call you at any point?
No. What do he want?
Okay.
Well, I'm going to go to the...
Pass.
Yes. Just for a little while.
Okay.
Okay. Oh, let's go back to this video. It's so important to understand that, the federal dollars are specific to intent behind the mandatoriness of public education. Oh, my cousin is talking to me. What do you say?
Maybe I'll see you Christmas.
Let me go back to this podcast because I'm over here talking trash to my cousin. And you can't see what he's saying. But anyway.
What's that? Addressing learning loss. That could include, right, high intensity tutoring that you may want to provide.
No.
A particular level or a particular student subgroup that may need additional
I don't think so.
learning.
It requires analyzing some real data
to help,
put my shoes on.
Help them around, addressing those learning gaps that they have experienced or unfinished learning that they experienced during this past school year, and getting them ready for the fall. Or it could be that you want to focus that funding on summer enrichment programs or other types of strategies that can address learning loss. And so that's a significant investment, again, under the American Rescue Plan, of pivoting towards really accelerating learning. And so that is also a major shift between the American Rescue Plan and CRRSA. The other set-asides that are more prescriptive, at least at the state level, at the SCA level, is shown here on this slide as well, which is different again from CRRSA and CARES. As you'll recall, state education agencies were allowed to reserve 10% of their funding to address the specific needs of their districts and schools that have been impacted by the pandemic or hardest hit by the pandemic. Under the American Rescue Plan, Congress was pretty prescriptive in terms of how states have to use those dollars. Again, all trying to address learning loss and accelerate learning. So 5% of that 10% funding pot that NDE has available to the agency has to go towards evidence-based interventions in addressing learning loss, quite similar to the allowable activities that I described under the LEA set aside. Also, there's 2% that has to be set aside, one to support the identification and implementation of summer enrichment programs, as well as comprehensive after-school programs or before-school programs. And so that 2% has to be specifically dedicated to that. And then you have 2.5% that is really flexible for state.
We have a text message here. Okay. Didn't say nothing. Okay, so let me explain what he's talking about. Because he's talking about, the flexibility and school-wide programs, how you can use the resources, the federal resources, to ensure that adequacy is happening for all children, perhaps, And it's just unfortunate because the children that he's talking about that should be included are not included. And so therefore, Nevada has not held itself accountable for the achievement of all students. And I do mean all students. So therefore, this was in 2021. Most of their meetings are not like that. But this is clear instruction, as if they didn't understand the use of the money. Let's listen a little longer.
It's to really target their funding towards specific needs and interventions that they have identified as a high level of need of support at the district level. And so they, again, NDE has probably gone through the process of identifying what those needs are and can use that flexible pot of funding, which is a lot, for the state education agency to support districts and schools in their learning recovery efforts. So in terms of allowable uses, so what does this mean for districts? Again, the allowable uses for districts, so outside of that 20% set aside, right, that I just mentioned, that has to go towards addressing learning loss, the other, 80% can go towards, similar activities that were supported under CARES and CRRSA. So again, a lot of the things that we've seen in our work with states and districts during this period has really focused on, right, additional staff compensation. I know that's come up, or that came up when we met with you all in March. So again, the teacher shortage issues that have been presented during this period, or that were present before, around, effective recruitment and retention challenges, and addressing that by bringing on new staff in key content areas where you have some shortages, or finding ways to incentivize particular teachers to move to schools that have been most impacted by COVID. So these are sort of ideas or strategies that, districts have really sort of focused their funding on. Transportation is another one, right? High quality instructional materials or curricula, especially in the K-3 space around early literacy has been a high sort of allowable use that many districts have used, that we've seen in our interactions with them. So those are some of the ideas. And then you see here, of course, focusing on social and emotional well-being of students by increasing school counselors or other mental and behavioral health strategies, broadband, as I mentioned before. So there's a number of, still, again, the main theme from looking at CARES, CRRSA, and ARP the major theme is a lot of flexibility, right, in terms of how you use these funds. But again, a huge investment on making sure that we're pivoting towards accelerating learning and addressing unfinished learning. Now, I had hinted at, because again, back in March when we met, I think the American Rescue Plan was about to pass or had just passed, and the sort of the new provision around maintenance of equity had just been sort of fresh in the minds and sort of our knowledge and awareness in terms of what was in this plan. And so in terms of effort and equity, the American Rescue Plan, just like in CARES and CRRSA, has a maintenance of effort provision, right? So states have to continue to fund K-12 education at the proportional levels that they did pre-pandemic. So for over the, for fiscal year 2017 to 2019, they have to maintain that same funding level. Yeah, that's how you guys figure you can catch them that they've had in the past. On top of that, they also have to make sure in terms of the equity provision in fiscal years 22 and 23, make sure that for their high needs school districts, they are protecting them from any spending reductions in terms of making sure their state per pupil funding for the neediest half of those districts are not reduced by an amount that exceeds the overall decrease in state funds. So again, as Jason will probably talk about in his presentation, the impact of the pandemic on state economies has been uneven. Some have fared better than others. And so this, the maintenance effort as well as the equity provision for some states might not be a major issue, but it will be for some in terms of how they ensure that states that are, the districts that have been hardest hit during this pandemic are still receiving the same amount of funding that the state has provided other school districts. And that's because, again, during ARA back in 2009 and the experience from that whole time period in terms of how funds were equitably distributed, a lot of times when states had to make their state budget cuts, education was impacted, and the hardest hit districts were impacted the most. And so, again, the intent behind this particular provision is to make sure that we don't go down that path again and that we're providing the necessary funding for all districts, but especially our hardest hit districts, and making sure that they are continuing to receive the funding that they need during this period. The other provision I'll mention on here is the maintenance of equity provision. Again, the intent here, is to make sure that LEAs don't decrease their per pupil funding or staffing levels for their hardest, for their high poverty schools. Again, now this can be in spirit, understand why Congress wanted to ensure that districts maintain their per pupil funding or staffing levels for their high poverty schools and that it doesn't exceed any district-wide reductions. Again, making sure that those resources are going towards our hardest hit districts or high need districts.
Sorry, time check. We have 5 minutes.
Okay, gotcha. Thank you. But the most important thing here, though, is that, and I'm sure you have a lot of questions in terms of the practical implications of, sort of carrying out this policy. I mean, again, if you need to make, certain staffing changes and hiring in particular, that could have an impact because, again, staffing is the biggest part of your budget. And, bringing on, new staff who might be not as expensive as some of your veteran teachers could have an impact on that per pupil funding piece or that staffing level piece. And so we hope that the Department of Ed, U.S. Department of Ed, will be coming out with further guidance about how you make those particular determinations. And Jason will get into that with you too in his presentation. The other key thing about this provision, though, is that there are some districts that are exempt from this. So LEAs who have a student population of 1,000 or fewer are exempt from this. Single school LEAs are exempt from this. And also districts can submit to the U.S. Secretary of Education a waiver request, based on any exceptional or uncontrollable circumstances, like a huge drop in its financial resources to be able to make or meet this particular provision standard. And so I think that's also something to be looking out for in terms of what the U.S. Department of Ed is going to be able to provide in terms of guidance and clarity on this particular provision, but as well as what it would take to, seek a waiver and get a waiver approved if that's where your district is in terms of need regarding this provision. Okay, and then the last slide here is more so just in terms of what you should be considering, especially, I think, around that 20% set aside for district considerations. So, of course, I know all of you in your needs assessment of where your schools are and how you have priorities possibly set for them in terms of how they can accelerate learning. Of course, you want to ask the questions around which students do we hope to serve, who are in greatest need around these accelerated learning strategies. What are our goals? What are the outcomes we hope to achieve? Again, there's a lot of resources that you can leverage in terms of not just the funding in the ESSER fund, but how are you going to leverage existing funds like Title I, Title II, IDEA? How you might be able to leverage some of the resources that NDE has available to the agency.
You guys, finish listening.
Has put out, a state spending application that the Nevada Department of Education has to submit. LEAs also have to submit to NDE their spending plan about how they're going to use these funds. So making sure not only you provide the rationale, you provide your identification of evidence-based strategies you want to use, but you also want to make sure that you're putting in particular mechanisms, evaluation mechanisms to see how you're progressing in the use of these funds and what outcomes that you're seeing. And that's so important, right? Because this is one-time funding, basically a 3-year window. But the important thing at the end of it all is that we're showing impact, right, as a field. And so I think it's important to put in those particular mechanisms. Another thing that Jason will really go deep in with you all in his presentation is how are you balancing between recurring and one-time expenses? Again, you'll have those one-time expenses around improving of facilities. You might have, a summer program, a summer school program that you want to implement for this year only. But then you might have some of those recurring costs, like, maybe if it focuses on, I saw in the poll, focusing on the student, social and emotional well-being of our students. And you might want to increase the number of school counselors you have across your district. That could be, again, a recurring cost. And so how are you factoring in, one, how can you sustain that recurring cost through using these one-time funds? But what else do you need to do once those funds are gone to make sure that, those strategic investments don't go away or don't burden the district in terms of cost and budget? And the last thing I'll say, again, in terms of things to consider is, again, I know all of you, either through, community surveys, through focus groups with your educators, with your families and communities, with your students, you've already done stakeholder engagement throughout this process. But another piece, again, to your LEA spending plan or application that you'll submit to NDE is going to require what stakeholder input you've received in sort of identifying the strategies and programming you want to support using the American Rescue Plan dollars. And so again, making sure that you're going through the process of continuing to reach out to your stakeholders, your communities, how to leverage these funds will also be essential. So I'll stop there. Jason, I don't know if you've been watching the chat, if there's any questions we have.
Yeah, we don't have any questions thus far. I know that Julie dropped in the questions for breakout. So
okay. So yeah, we're going to be now, I guess, just to keep us on track and on time, to transition to our breakout questions and reflections. So Jason just said, like, you all have your questions that you will be sort of grappling with during the breakout session. You see the 3 here on your screen, but also in the chat. And Julie, I don't know if you want to tell folks how much time they have.
Yeah, I just have 20 minutes in the breakout. We'll have 15 minutes for discussing these questions, and your facilitator then will ask you another set of questions for reflection for the Padlet, and I will send some warnings just about time. So we're ready to go into our breakouts.
All right.
Thank you. Welcome back, everyone. We're just joining back from the breakouts. Thank you for your time. I think everyone's back now.
Okay. Well, thank you, everyone. I know we try to add and pad in a little bit more time for you all to engage and interact with one another. The breakout group I was in had a very robust conversation. Thank you, Will, for leading that. And so I just wanted to take the time, if you guys could post in the chat, one takeaway from your group conversation. I know there was a lot of conversation in my session, sort of talking about school reopening and how you're going to engage with stakeholders and identifying, what kind of needs and resources from the American Rescue Plan that could support your particular district or schools. So if there's a takeaway like that in terms of what you're going to do around meaningful consultation or how you're going to blend and braid the funds to support particular goals, you could drop that in the chat. That would be great. And then the other thing that we would like to hear from you all, from your groups, is what was one question that was sort of that you needed addressed that maybe we can talk about during this period. So we have about 4 minutes. So if you could just drop that in the chat, that'd be great. So I see Deanna has said importance of identifying at-risk students. That was a theme I think in Will's group, sort of talking about how can we use student achievement data, attendance data, other critical data in the needs assessments of your school's needs to then identify what supports those at-risk students might need. And then the question I think Deanna had, I'm sorry, I'm trying to pull it back up. Robust stakeholder feedback, participation ideas. Jonathan Moore, Dr. Moore has the important role of summer learning to support all students. I think that's a big issue as well. Engaged in their learning, engaged with their fellow students there's a huge SCA set aside and funding that goes towards that NDE could support across the state, and also districts, you could use your resources around that. Randy Drake, let's see. Patty Oya has how to measure gain of summer learning, especially around SEL. I think that's always been something in terms of assessment of summer learning, of social emotional learning, and how do you assess that? Has always been a big issue. And of course, I think that's going to be a major focus of many summer programs that we see. And then Will says Group 6 was really aware of the need of stakeholders' input right from the start. That is critical on our minds. Thank you, Will. So there seems like, again, a lot of general themes around one, as I think we said before, who are the students we're trying to serve? What are our goals and objectives? How are we going to measure the impact of that? And then I think, again, the meaningful consultation, the stakeholder engagement, definitely was a major theme in Group 6, and it sounds like it's been a major theme across all of the group conversations. And Julie, there is a Padlet, right? I don't know if that's going to be shared.
Yes, that Padlet's up there, and the purpose of the Padlet was to have the output from all the groups shared, so the Nevada department can come back and look at that and reflect on that too. So Thank you.
So so just so everyone knows, the facilitators sort of captured the main ideas and themes, and so yes, the NDE staff will take a look at that, and so your comments and your thoughts will be shared with them, and they will sort of use that to engage with you all and supporting you all in the use and implementation of these resources. So Julie, I'll hand it back over to you so you can hand it to Jason. And
I'm actually handing it over to Jason. So Jason, okay. I'll stop sharing and let you drive. Thank you, everyone, for your responses.
That was great. Yeah, I had a chance to stop into some of the rooms just to hear the conversation, which I think was really good. One of the things that had come up in the groups that I was visiting with was largely around the impact and the interaction between the availability of state funds for public education and how to use these federal funds in a way that promotes kind of sustainable practice. In fact, I think it was Brian that had put on the table, and I liked the way that he was describing this, was the kind of sustainability, not just of funding, but the sustainability of impact or outcome that you all wish to see in your schools, which I really like that framing. I may borrow that, Brian, if that's okay with you. So I want to compliment Augustus's setup in talking about the broad brushstrokes of the American Rescue Plan and some of the major provisions he talked about, and really take this into a context of how might school districts in Nevada really leverage those funding sources in a way that offers your ability to kind of meet the moment, if you will. And I think as just a couple minutes of context, I want to start with this statement. You may have seen this in Nevada headlines. Certainly has been floating around DC in terms of this being the biggest federal public investment in our lifetime. And as per usual with WestEd, we like to put data behind statements. And so we did. And this shows you a look at what the inflation-adjusted federal revenue per pupil has been in public education, going all the way back to the beginning of the 1900s. And what we can see far and away is that the combination of all three of these packages, CARES, CRRSA, and now the American Rescue Plan, really creates an enormous opportunity for public education to think about, from a federal perspective, how to think about investment in public education. The second way that we looked at this was really from the perspective of a percentage increase from year to year, decade to decade. And we can say again that, this has been the biggest increase in public education from a federal perspective since the New Deal. That's the kind of big bar off to the left at the 571% increase. That was basically between World War I and II, coming out of the Great Depression. For any history buffs out there, you can see the 1960 to 70 increase of 200%. That was the Johnson administration's really big press on Great Society. And then you can see the investments in ARA that happened in 08-09, which are basically dwarfed by the current investment increases that we're seeing through the combination of these three packages. I recently had a conversation with a colleague, like any other parent, I've got 3 kids in school. I'm kind of over the at-home learning, and really just, I love you guys and you need to go back to school. So this desire of getting back to normal, I think is a very shared sentiment by parents, especially those that are working parents and, struggling to figure out how do I balance professional life with my personal life. And I was also reminded that, in this urgency to get back to normal, we can't forget that normal wasn't good enough for a lot of our kids, for the vast majority, especially of our lowest performing kids. And so it's important to think about that in the context of the scope and scale and what we have available to us through these federal investments, what we can do on behalf of these students. Augustus touched on the length of time in which these funds can be used, and I, was happy to hear in the breakout that I was part of, many of the districts already submitting for tidings and for those extensions on 1 year. It seems more like the trend in Nevada is application for tidings for the CRRSA and American Rescue Plan funds than for CARES. But even still, that you all are thinking about and taking advantage of additional amounts of time to think about the planning and use of those resources is really important and something that we applaud in your planning and execution on the use of these funds. So this is one dimension to look at it. The second dimension, and this builds off of one of the things that Augustus was saying, was thinking about how we would model the implementation of these funds across school districts. So the graphic on the right-hand side provides you a bit of a sense of the magnitude and how those dollars might be used across multiple school years. And in that way, you see almost like a very natural kind of ramp up and ramp down sequence of funds. And in particular here, we think that there's a set of activities that school districts should be engaged in as they are both ramping up into the use of those one-time funds, but then also when they ramp down. And some of those are mirrored and similar, but some of them are distinctly different. And so an example of this is in the report outs, I saw a bit of commentary about getting your arms around what the needs of students are. And so that needs assessment component, understanding where students are and what their needs are, is a really important component of a ramp up. But where that looks a little bit differently on the ramp down is how you are measuring your increases in capacity as these one-time funds are being used. And it's that measurement of understanding what of those dollars will not be able to be replaced, but what of those dollars should you substantially be thinking about that are going to be important in a ramp down phase as you move out of a situation of having this set of one-time resources into ongoing resources that are provided by the state or the federal government. One of the important confounding factors that we've seen across the country is how districts are going to deal with enrollment decreases. We've primarily seen kind of two strategies, one at the state level and one at the school district level, that in the immediate term are trying to address these enrollment decreases. The first is that states will often, in some cases, take a hold harmless approach. So they'll say, we're basically going to hold you steady at an enrollment level prior to where we saw these enrollment decreases. Now, that's good because it creates space for the district to plan, but you still need to plan for those ongoing decreases depending on the proportion of students that are leaving the system. In a recent bit of work that we did in California, what we're seeing is that of the total enrollment decreases, about 50% of it is attributable to what we would describe as temporary. So that is that we're expecting that enrollment to come back. And then the other 50% is really attributable to basically permanent losses in enrollment. So these are students going to private schools, students are going to virtual charters, or moving out of state, depending on the place in which they live. So it's these combinations of factors in thinking about a large amount of one-time funds in combination with impacts to ongoing funding sources that are really important for districts to be thinking through. And I think as this had come up in the chat, and I think is very applicable in Nevada's circumstance, the state legislature is dealing right now with trying to reset what the funding formula is going to look like. And that will have implications for how you think about the use of resources. And David had mentioned this in the breakout, and I think it's spot on, that understanding and knowing some of those answers are going to be really critical in planning out the rest of the use of those funds in terms of how you are supporting certain resources with certain pools of funding in the future. I will say, just a caveat on that comment from David, is that some of those needs exist today, and there's so much of this one-time federal funds that it seems reasonable to be working on some of those really urgent issues with some portion of those funds, but reserving a large proportion of it to get some clarity from the state legislature on the state funding formula that's coming through in hopefully about a month or so. So a couple of other things that we think school districts could really be thinking about in terms of confronting these challenges. I talked a bit about the one-time revenue for ongoing expenditures. In the next slide, I'll spend a little bit more time on that. The next thing here is really intentionally planning for those sustainability opportunities from ongoing federal, state, and local funding streams. And I think one of the things that we want to emphasize is the need to create time and space for local leaders that do three specific things. One, prioritizes, right? So it's not just funding to the list, but it's like, what is the system really going to think about wanting to do in the longer term in terms of supporting those students, particularly at-risk student populations, and then taking the time to understand how to braid different resource pools together in order to accomplish that prioritization. And I can remember I was in school systems during the Great Recession and coming out of the Great Recession. And one of the things that was the most beneficial to us, because otherwise we were literally running a mile a minute, and in this circumstance coming out of the pandemic, I imagine it to be even more accelerated in terms of the decision making you need to make, is to literally create time and space, like to block out times over the course of 3, 4, or 5 months for district leadership to really talk through these issues, to bring data into the room, to make better informed decisions about different types of strategies and moves that may not be as kind of well tuned in school systems, particularly when you're looking at negotiating between ongoing and one-time funding. We think the last kind of challenge, but the opportunity that really exists here, is to communicate about what is helping students and how the federal investment is working on behalf of children. I will say that a lot of what we've observed in the field is that many people are paying a lot of attention to where this funding is going in public education. And in that way, it is our responsibility to think about how to leverage those dollars well and institute and implement them well, but also to measure.
And that's just the truth, because, these are not-for-profit organizations, but they claim to be helping their districts do the right thing. And it's unfortunate that the right thing hasn't happened yet, and that they're helping them from wherever they are on the bottom. But the help is to stay on the bottom, not to move up. So we're going to talk about this, as this was in May of 2021, and it is now December of 2024. So let's just listen up. This was West Ed talking to Nevada in regards to the ESSER funds, that Every Child Succeed funds, and the American Rescue Plan. And as it stands, it was information that LEAs needed to know. There's a news break. Let's see what's on the news flash. News flash says, Clark County DA says punishment doesn't fit the crime for Raby the bulldog. What did the bulldog do? Clark County's top prosecutor speaking out in the case of Raby the bulldog, pushing for a change. Well, what can I say? I don't know what the bulldog did. What can I say? Yes, it is, whatever. But we don't have time for any of that. Let's finish, because I got to get ready to go.
Measure, document, and then disseminate how those dollars are being used well. And I
Please
think
disseminate
this has already come up in the course of the debates around the follow-up from the CARES funds, in which many congressional staff and elected leaders were making these very overt comments about, well, I don't want to support another federal package because this report in front of me says that only a third of the funding has been spent from CARES. And the story behind that is much more complicated than simply a proportion of funds spent on a report. And it's important that as local leaders, you're really thinking about how to communicate that to your community and documenting the effective use of those resources over time that are addressing both the kind of urgency of the moment, but also planning for more sustainable impacts for students in the future. So I wanted to return to this negotiation between one-time and ongoing. And in particular, we have kind of 3 ways that you might want to think about approaching the segmentation of these funds. The first is really in addressing infrastructure. And so these are your very straightforward, I'm going to spend these dollars once, I'm going to get something for those dollars, and it's going to create a benefit for the system. So 2 really clear examples of that: hardware and software for technology that tend to have a 3 to 4 year life cycle, or building upgrades and maintenance. Now, a lot of that's already associated with much of the commentary that's out there about what's necessary to get kids back to school. Most of the systems in Nevada are already back in school, so maybe there's not as much of a need there. But these are really clear-cut, one-time investments that are non-recurring that create longer-term benefit, right? So the hardware and software question, you're probably not going to need to revisit for another 3 to 4 years. Upgrades in buildings and maintenance, you're talking about probably a cohort of kids that will move through the system before you have to think about those types of investments. The second one that's been really kind of popular and I think, has obviously gotten a lot of attention is how to think about learning acceleration. And in particular, a lot of ideas that have come forward around high dosage intensive tutoring, summer school opportunities, or extended learning beyond the regular school day are all things that are now floating around and that many of you guys have already started to institute. And what's both a benefit but also difficult about these types of strategies in particular is that they do require ongoing funds. If you're going to extend the learning day by an hour or 2 hours, you're going to have to continue to pay somebody, right? Some set of teachers or instructional aides or other support staff at the school in order to keep the doors open longer to support those students. The same is true of summer school, though there's probably a little bit more of a one-time nature of that, depending on how long you're looking to sustain those summer school opportunities. But also the high dosage intensive tutoring is also something that is probably potentially ongoing, but maybe a little bit more cost effective, depending on the type of labor that you're thinking to bring in and align to what learning is happening in the routine and regular classroom. So in this way, this bucket in particular is the one where we think school districts could probably get into the most trouble if they're not thinking clearly about what's the strategy we want to institute now and what do we want to test as being what's going to be the most effective in driving learning for students in which environment given the context in which we're working. The last bucket really focuses on the kind of innovation and sustainable practice. So in this way, these are investments you would make one time, but that create ongoing benefit time and time again. So one of the clear examples that we have of this is, and Augustus had brought this up in the focus that there's been around the country in early learning, for example, and looking at blended intervention strategies for students that are, say, English learners, or that might be in special education pre-referral. So you can take some of those one-time dollars that you have access now to from the federal government and say, how do we get together our best in the school system, right? Our best teachers, our best instructional coaches, our best administrators, and ask the question, are we doing enough to ensure that we're getting intervention early enough for students before they are moving into special education or before it becomes more costly to intervene and support that student along the way? And you can sustain that kind of planning effort and then implementation effort with the federal funds that, if implemented well, is basically going to be sustained in the system over time, which means you can basically remove the one-time funds around the planning and the implementation and create that longer-term ongoing benefit. And that's this element of system transformation that we think is really critical in demonstrating how the system is rethinking its approach to public education, especially, reflecting on the last year and 14 months of working with students largely from a distance. So I want to take just a moment or two to talk a bit about this equitable distribution of funds. This is the LEA provision in the American Rescue Plan. Here's the straight language that's currently written in law. As Augustus had mentioned, we're expecting some type of additional guidance that's forthcoming, but I want to put some ideas in front of you to be thinking about how you are managing managing through this provision in particular in the allocation of your ARP funds. And so it says, basically LEAs can't decrease either their per pupil funding or staffing levels. I'll come back to that for their high poverty schools by an amount that exceeds district-wide reductions. That is, so say in a school district in Nevada, school systems had to reduce in the school district their funding by 5%, right? They have to be able to demonstrate that for their higher poverty schools, they didn't reduce that amount on either a per pupil or a staffing level by more than 5%, basically. So a couple things here to keep in mind. One, keep the intent in mind, right? The intent is really to make sure that more dollars are going to those schools that are serving higher need populations. And the beauty of this is that Nevada is already on this path through the people-centered funding formula, right? So following through on that thinking as you're considering the use of these federal funds and how that shows up at individual schools is largely going to keep you on the right path in terms of meeting the provision that's laid out here in the ARP. This notion of the per pupil funding or the staffing levels is a really critical decision because you can lead to two really different outcomes depending on which one you choose. And there could be some circumstances when you calculate this in which the per pupil funding measure, you can meet that box, you can like check that box, but in another calculation, if you do it on the basis of staffing, you may not meet the provision of the law. So we think it's important to really be thoughtful about, are you calculating on a per pupil basis? Are you calculating on a staffing level? And again, return to the intent of what is going to be best for the student population in that school. Are they getting a set of resources that are really going to help them proportional to how other students have opportunities in the system? The last thing that I'll mention on this is this provision is really about a floor, right? It doesn't regard systems that are adding funding above a maintained base of dollars. So, for example, if you were to provide more funding to systems, to schools in your school district, the provision really thinks not about that, but really when there are decreases in funding. So what the federal government's aiming to do here is really to maintain a level of funding that's going out to schools. So in that way, if that becomes a circumstance for Nevada, it's important to think about the combination of both state, local, and federal dollars and how they're showing up to school systems.
It's important to know that.
So one or two other slides here in our conversation, and I think importantly, one of the things that we have to think about is what are the combinations of these other resources that are important to consider. So WestEd has taken the time to think about how do resources from these federal aid packages show up in school systems. And largely, we're looking at the kind of first, if you go all the way over in the left part of the graph, the kind of federal Department of Education dollars. That's largely what we've talked about. But we also are aware that there's dollars that are coming from the Department of Health and Human Services, the Department of Agriculture. The most recent American Rescue Plan, as Augustus had mentioned, includes a $350 billion allocation that's going through governor's offices for both state and local relief efforts. This is a tremendous amount of funding, as I said, that we've never seen in our lifetime. And so
and yes, it is. And yes, it was. It was a tremendous amount of funding that they had never seen in their lifetime. And guess what? They could still not be equitable with those resources. They still did whatever they did prior to. So you don't see children in poverty, the children of those children having access to early start. It's not happening. And then behavioral issues where they feel that they need to collect all of the data in regards to why your children are not benefiting from public education. Well, just understand it is where they're coming from. And there's a whole poster. I'm going to take a picture just a minute so you can see it. Okay, let me just camera on. I'm going to take a picture of my screen, not me. Turn it around. There we go. So I did snap it. And I did. Go ahead. There it is. So that's all of the available funding. And believe me, you just need to understand the federal dollars, how the federal dollars come in. Education, health, and human services, and agriculture, meaning free lunch and free resources. And then the state has education, social services, health services, and public health services, and colleges, community colleges. And then the local district breaks that money even down further. It goes into local schools, school districts. First, Fresno ECE, early childhood providers, behavioral health, health and public health, social services, local government, and public colleges and universities. And it just goes to show you who's on the payroll of the public as it is we the people, we the people. But understand, a failure to comply is just that. And we may trust in God, but we don't trust blindly. So in the real world, the reality says, who will you be in the year of 2024? And I say, like, I say share, and I say subscribe. I say follow me. But no need to follow blindly. Just go to usa.gov and then understand all of the changes when local control came into play. And then ask Google to tell you what is the control factor